Hello and welcome back to Live at FDIC, brought to you by Firehouse Subs, the firefighter-founded hot sub chain with a passion for hearty and flavorful food, heartfelt service, and public safety. Ready for your next mission? Firehouse Subs is offering firefighters the opportunity to continue serving after service now as restaurant owners. Learn more at www.firehousesubsfranchising.com. My name is Chris McClune. I'll be your host for this segment. And with me is Mike Gribb. He is with Zoll. And we are going to be talking about, I guess, in a way, some things we've been talking about all week at these different podcasts. It's been interesting this year. The ones that I've done, there's been a lot of technology, talking about a lot of innovation, maybe things that you can't pick up and look at, but, just the concepts of what's coming and how these things can work. So where I'd like to start is, how is innovation shaping the future of EMS and empowering professionals to deliver the highest level of patient care? When we talk about innovation, it's everywhere. So just how does that work?
Thanks, Chris. So so it's a pretty exciting time in EMS. So I've been involved in EMS since 1996, and I think from an innovation standpoint, I think we're seeing a lot more real-time feedback. Mm-hmm. Right? Okay. Providers know what they need to do, but for years they've been doing it blind. CPR, for instance, everyone can recite guidelines, mm-hmm. chapter and verse, but we've never measured it for decades. We didn't measure it. So how do I know I'm doing 2 to 2.4 inches? Right? We all sing the songs in our head, but again, can I have a real-time piece of feedback that's showing me my actual rate, my actual depth? How much feedback can I get? Same thing with ventilation feedback. We've introduced ventilation feedback on our devices a couple of years ago, real-time ventilation feedback. So I feel like we're providing more information for mm-hmm. providers to make better clinical decisions. We're not the ones out saving people, from the manufacturing side, but we like to feel like we're giving the providers better tools, more information to perform to the level that they know they're capable of.
And those decisions have to be made so quickly, as you're performing life-saving operations there. That I look at it almost like this being dispatched to a fire, where you're processing a tremendous amount of information very quickly to make those decisions. In this case, clinical decisions, and obviously having the information at the ready as much information at the ready as you possibly can to help you do your job more efficiently is critical. And that's almost how I look at it a little bit, is the efficiency of the work that you're doing.
Absolutely. And it has to be simple, right? Again, we're talking about some of the more critical patients. The more critical the patient, the more important this feedback is. And so it has to be simple. It has to be intuitive, easy to understand. It can't be a lot of deep menus to get to it. It basically has to be, essentially put whatever it is you're going to be working on the patient, and it should appear for you. If we make you go searching for it, providers aren't just not going to use it because they're not going to think about that.
On the technology side, is for EMS specifically, what types of advancements have been made of late?
So I think it's the amount of information that we can provide, and it's also the algorithms. And look, I've been a paramedic for a long time, and I'm very much you can pry my manual defibrillator out of my cold dead hands, right? I don't like to give up skills. I will tell you, with the way that the AED systems function today, all the things that we can do in an advisory mode, I think my advice to the providers out there is trust these algorithms, right? The AED algorithms are brilliant at this point. They're fast, they're accurate. In all reality, I've always thought I was a great provider. Great is probably a little, maybe a little overstated, but I always thought I was a strong paramedic. Mm-hmm. I can't beat the algorithm in terms of speed. Mm-hmm. And then it allows us to do some pretty unique things. If we allow the machine to analyze, we've got a technology in one of our devices, which is one of my favorite things to talk about. I'm sure all my friends in marketing and back at Zoll are cringing because they hear me talk about this all the time. But in our AED mode, we don't just analyze is this ventricular fibrillation? Is it VTAC? Is it a shockable rhythm? We can actually talk about the likelihood that that shock is going to, or that patient's going to respond to that shock. So we have a technology called shock conversion estimation, where we've actually found positive and negative predictive thresholds where basically I can tell you if the amplitude for VF is under this threshold, that patient is 98% likely to defibrillate into asystole.
Okay.
Or over a certain threshold of the proper amplitude of VF, they're 84% likely to shock into an organized rhythm. So now it's not just shocking a shockable rhythm, it's shocking a shockable rhythm that will respond appropriately. So there's a lot of advancements there. And then again, on the 12 lead interpretive side, ton of advancements on the 12 lead interpretive side. Special criteria for female. We're really targeting a fantastically underserved population, right? We've been able to be more specific, changing the criteria for female patients, identifying through some really intense confounding factors. So the algorithms continue to get better year in and year out. And I think that's the advancement is, for these providers who don't see some of these subtle changes every day, right? That they may not be doing 12 leads every day, or they don't run into these anomalies every day. The algorithms have gotten much, much better. If you talked to me 20 years ago, I would have been completely anti-interpretive algorithm. I'm going to interpret my own 12 lead, but they've gotten so much better at this point. I think we're putting better information in the hands of the providers to make better decisions, whether it's transport or treatment decisions.
Talk about intuitive solutions and how they enhance clinical decision making.
Yeah, absolutely. So if it's not intuitive, it's not going to be used. So we can give you some of the most fantastic information on the screen, but if it's difficult to get to, if it's hard to understand, then there's no benefit to it. And I will say one of the things, from a regulatory perspective, the regulatory landscape has changed for medical devices, but as part of the new regulatory, and everybody kind of groans when you talk about regulatory. One of the things that we're required to do now is that anytime we bring a new technology out, we actually have to do usability testing. So our engineers will design some new piece of equipment, and then they come to one of the teams at Zoll and say, okay, here's the new technology. We're going to bring in a target audience. So we're going to recruit paramedics and EMTs and nurses from the field. So whoever our target audience is, we have to put together what a training package would look like for the standard EMS provider. We bring them in, we train them, we send them out for 24, 48 hours. We bring them back in and they have to be able to perform the tasks. So it's forcing medical device manufacturers to make things that are simple to use. And again, I like it from a user perspective because, again, we can build the best tech, but if it's hard to use, as right. Dealing with anybody in healthcare, if it's hard to use, it's just not going to happen. So I think it has to be great technology, but it has to be simple and easy to understand.
What about AI? Does AI come into this at all with any of the solutions that you provide, or just in general? Because we hear it all the time. Like I said, we've been talking about a lot of technology this week, and it seems to be making its way into just about everything.
It is, and so AI is certainly something that we're looking at from the device side. As you start looking at AI in making anything that's involved in clinical decision making, it's a little bit more difficult. There has to be a lot of clinical data behind it. There has to be a lot of research. Now you're talking about testing, validation. There are regulatory hurdles. So, I think we're in this great period for AI where we're seeing it build. We're seeing more interest in the healthcare field, and you're starting to see more clinical data come in. And so, as we start getting more clinical data, as these regulatory bodies are willing to accept more of that, you'll see it trickle out into the devices. So I think, from an AI perspective, there's quite a bit that's on the horizon, and it's, whether it's, ultrasound and helping providers with fast exams where you're looking at some really subtle changes, right? Can AI help, identify imaging, cardiology on the back end? Is there, AI can generally move faster than, development of new algorithms or incorporating new changes. So how can we leverage that, whether it's on the device or off the device? So it's a pretty exciting time. AI is really, I think, just starting to make it into, at least in our space, into some of the medical conversations. But I think going forward, over the next 5 years, I think it'll be pretty fascinating to see how much AI gets out into, especially into the emergency space.
We are at FDIC. So just, are there any solutions from Zoll that you'd like to highlight today that people can see for the last couple hours here?
So again, our real-time feedback. We're really proud of our CPR and our ventilation feedback.
Mm-hmm.
We have a pretty cool system of care. So our mechanical CPR device, our AutoPulse NXT, actually physically communicates with our monitor,
Mm-hmm.
and they work in synergy together. So I think that if you have some interest in resuscitation, come by and see that. And then I again, my friends at Zoll know I'm kind of a 12 lead guru. I for myself as a 12 lead nerd, and we have some really exciting stuff that the 12 lead interpretive algorithm can do. And again, for people who are not running 15 or 20 calls a shift, right, where these rules and all of these criteria is so hard to remember. There's a lot of cool things that we can do with our interpretive algorithm to help people with their job and identify some anomalies that really, unless you're doing it every day and unless you're really well versed, you're just not going to remember. So we've got quite a bit to showcase. If they want to come by the booth and see us, we're always happy to talk.
Cool. In terms of innovation, that's what we've been talking about. Is there a particular area in EMS that you feel is seeing the most innovation right now?
I think honestly, it's the innovation is starting to spread much broader. So
Mm-hmm.
obviously, cardiac arrest has always been a big focus, and there's certainly a lot of focus on that. And you've got different studies out there with vector change for defibrillation and dual sequential. My regulatory folks at Zoll will like me to remind you that it's still an off-label use for all of us, but there's some really cool research out there coming out of Canada with Dr. Cheskis and Ian Drennan. But I think that we still focus on that. But I think the industry has started to look at it as, okay, that's 1% to 2% of our calls. What else can we do? So now we're starting to focus on trauma. We've got a traumatic brain injury dashboard on our devices. So you're just helping providers really focus on what's important to treat traumatic brain injury patients. We're starting to look more at cardiology. Mm-hmm. We're starting to look more at these different disease states, sepsis, and trauma. The big buzz in EMS now is blood transfusion, whole mm-hmm. blood, which is amazing. I never would have imagined when I started as a paramedic in 1999. Never would have imagined we were giving whole blood in the field, but just an amazing advancement. And so we have some monitoring capability. We can show, we can actually run a true non-invasive hemoglobin value off of our devices. Mm-hmm. But I think we'll continue to look at cardiac arrest. But I like to see how the industry has branched out and realized, okay, there are so many more patients out there that actually represent a higher percentage that mm-hmm. really need some focus. And I think you're seeing that the innovation shift out to incorporate more patients.
If there's anyone who couldn't make it to the show this year, how can they find more information out about Zoll?
Oh, absolutely. So you can always go to the Zoll website and request information. We have information about all of our different platforms, all of our different technologies. You can contact the organization. You can reach us through social media. Our marketing team's great about responding to social media requests, whether our Instagram or any of our posts. Okay. But the website's generally the best way.
And that's Zoll.com?
Zoll.com.
Zoll.com. Okay. Well, Mike, I want to thank you for sitting down and talking to me today about some things about innovation in EMS. It's been a big week here about just across the board, innovation across the board in so many different respects. And it's been great. It's been great for me to learn about it from a variety of different angles. I'd also like to thank Firehouse Subs, who has been our sponsor this week for the entire podcast studio, as well as providing lunches for our hands-on training classes. It's been a great relationship, a great partnership, and of course for everyone who came to the show. If you have missed any of these podcasts at the show, make sure that you go to the FDIC International YouTube channel. They are all archived there. FDIC.com. Also, will have information on that. They'll have information on next year as well. So again, my thanks to you, Mike. My thanks to Firehouse Subs. Again, this has been Chris McClune for Live at FDIC. Have a good one and stay safe. Thanks again, Mike.
Thanks, Chris.